We are here with our very own living donor social worker, Jennifer Whitmore. Um, it is Donate Life Month, and she is going to be presenting for us today and talking about living donation. She's our living donor social worker. So, everyone, welcome Jennifer Whitmore.
Hey, Jennifer.
Hey, Jennifer.
Welcome.
Thank you, guys. I'll start sharing my screen. We'll kind of do a PowerPoint, and then you guys are free to ask questions because I know a lot of people will have questions.
And just a reminder, after Jen is done, everyone, please stay on because we want to talk about, plans for the rest of the year and what educational topics everyone might be interested in, if there's anything special that we can present for you all.
Okay, I had to ask for permission. Oh, there we go.
Okay, I just think I gave it to you.
You want to be on screen?
And just some introductions. This is our living donor team. We have 2 nurse coordinators, Turn and Jacqueline, and Stephanie just joined our team. So eventually I'll add her to this. But I like to wait a little bit when they first join. And then, of course, I'm Jennifer, our living donor social worker here at Mayo. And then one thing about the living donor team is that we're completely separate from the recipient kidney team, just so that there's no conflict of interest. So we're not allowed to share information with recipients on like donor status. And then they are not allowed to share information with you about your status as well. You guys would have to share that information between yourselves. So what we're going to talk about today about what is living donation, how to find a donor, potential solutions to common problems. So why should you consider living donation? So kidney donation is very safe now, and the waiting time for a kidney transplant is going to be shorter just because this is something you can schedule, and donor evaluation takes less than a year. I don't know why it keeps skipping. The wait time for a deceased donor kidney transplant
Sorry,
is
I
pretty
can't
long.
see. Is this supposed to be a presentation? Because it's not coming on screen.
Oh, you can't see it?
No, I'm
That's
seeing-
right. We can't see it.
Weird.
Hold
Let me try
on.
again.
I saw it, Jen. Is no one else seeing Jen's screen?
No.
No.
I'm not.
Weird. Let's try again. Are you guys able to see it?
No.
No.
No, I can't see it. All I see is the person who just said, I'm seeing Jen's screen.
Yeah.
Shared screen can
That's
be
Lakaya.
only seen by host and co-host. That's what it says.
It's only seen by me and you, Jen.
That's all.
Yeah.
I can see you.
But I don't know how to
Hold
do it
on.
because I can always email you the PowerPoint.
Hold on. Yeah, send me the PowerPoint, Jen, and let's see if we can do it that way.
Yeah. Sorry,
thought
we're
I
having
gave you-
difficulties, guys. Thanks
Oh,
for
hold on.
speaking up.
Yeah.
Oh, you figured it out?
No. I thought it said allow you, but then I don't know what happened.
Well, I'm glad you guys said something and didn't just sit there and let me talk to
Yeah,
nothing.
I was just staring at Lakaya.
That's it.
All right. Stop your screen share, Jen, and let
Okay.
me try.
You know, one day I'm going to do this without having any technical issues.
I think we have issues every year.
Every time. I was like, this is going to be the year.
Yeah, you can't share your kidney unless you can share the screen.
Right?
Good point.
Give me 1
I like
second.
rainbows with all the squares. You can see other people. I can't see anybody.
All right. Let me know if you can see my screen.
I
Yes.
Yeah.
Yes.
Screen sharing has started and I see a slide, living donor kidney transplant.
All
Yeah.
right.
Me too.
Perfect.
Right. We can see your screen.
Okay. All right.
Oh, good.
So I'll let Jen start. Okay.
Yeah. I was like, they already know how to do Zoom at this point. And then this is our living donor team. We have 3 nurse coordinators, Turin and Jacqueline. Stephanie just started, so I haven't added her yet. and then I am the living donor social worker. And then we share the same nephrologists and the same surgeons, so that's all the same. The only difference is we're not allowed to share information between donors and recipients. And then we're going to learn about what's living donation about, how to find a living donor, and then potential solutions to common problems about finding donors. And then why should you consider a living donor? Kidney donation is safe, and the waiting time for a kidney transplant would be shorter. And then, of course, you guys know the wait time for a deceased donor kidney transplant is longer. Only about one out of 5 newly waitlisted adult patients received a deceased donor kidney within 3 years. And I know here at Mayo, it's like between 3 and 5 years. And then we also want to limit people's time on dialysis because it has many health benefits. And your success for like accepting a transplant is better if you are on dialysis for a shorter amount of time. Oh, that's the same slide.
That's the
weird.
same one? Okay.
Yep. And then again, living kidney donors last longer than deceased donor kidneys. So they usually last between about 12 years. A deceased donor kidney lasts probably like 5 to 11 years. It kind of just depends. But I've seen living donors last maybe 25 years, 30 years. It really just depends on who you got that kidney from and how you take care of it. And then the survival rate is also better with a living donor versus a deceased donor transplant. So you see at 5 years, living donor transplants, 87% success rate. For a deceased donor, it's about 75. And then with dialysis, 42%. And then for 10-year, 55% with a living donor, 46 with a deceased donor transplant, and then about 20% with dialysis. I just want, yeah. So again, why you should consider a living donor. They always usually have immediate function, and you get to schedule this surgery, which is kind of nice versus waiting for a call. Kind of gives you a little bit more control because you don't have a lot of control during this process. So what can you expect during donation surgery? Most donors are only going to spend 1 night in the hospital unless their pain isn't managed. It's minimally invasive. It's a laparoscopic procedure. I've been here 5 years and we've never had to open up a donor. Knock on wood, hopefully that does not happen. And then generally donors can return to all of their regular activity within the 6 to 8 weeks of surgery. And if you work an office job, usually they're back to work in like 2 to 3 weeks. And then who can be a kidney donor? Anyone who is healthy. Our approval rate at Mayo Clinic, Florida is between 40 to 50%. We don't have an age limit here at Florida. Typically, the oldest we'll take is around 75, but we don't have an age limit. And then you have to be 18 or older in order to be evaluated. So what does a donor need to do to donate their kidney? They go through a similar evaluation to you guys. It's a general medical evaluation. They have blood and urine testing, CT imaging to assess their kidney anatomy. The evaluation usually takes about 2 to 3 days on site, and then there are other appointments that can be virtual. And our goal is to make it 1 day. I don't know how soon that will happen. And then what happens if a donor decides they don't want to do this? They can stop the donation process at any time, and all discussions and decisions made by the donor are kept confidential. And does the donor need to pay for anything? So the cost of the evaluation and surgery will be covered by the recipient's insurance. And there are now options available to help donors with lost wages, travel, housing expenses through the National Living Donor Assistance Center and National Kidney Registry. And then that's just more information about NILDAC, but it kind of helps people not have to worry about taking time off of work. And that all sounds great, but how do you find a living donor? So I always recommend start by writing a personal story. So you're not necessarily asking someone to donate to you, but you're kind of just sharing like a story about who you are, your kidney disease, and what you need to do to become healthy and how a living donation kidney would be good for you. And then circles of influence. So, everything rumor, like information spreads. So you start with like your close friends and family, and then they kind of go to like their outside circles, like their work, their social clubs, their church. So it's kind of just spreading it around to all those circles of influence just to get the words out there. And that's just an example of a letter of, sharing your story. And some common concerns about getting a kidney donor is that people don't like having to ask others to donate for them. So don't ask for someone to donate to you. Just start by asking friends to help you spread the word about kidney disease and living donation and share your story. And then tell your story as often as you can, what you've learned during your transplant evaluation, and about the options available to you for treatment. And then, sometimes you don't know what to say. So keep things simple. If someone expresses interest in donating, provide them with their contact information to the living donor team, and then we can take it from here. So you don't have to do anything else. And then we also recommend getting a living donor champion. Some people who undergo kidney transplant may be hesitant to talk about their kidney disease, or they don't like to talk about themselves. And sometimes it's easier for friends and family to help because they want to be helpful, and this gives them something to do. And a living donor champion can help you tell your story, and they can help you spread the word about kidney disease, transplant, and living donation. And then this is just one of our stories here from Mayo Clinic. So we had a sister who donated her kidney to her brother. During the surgery, they were also enabled to include her cells, which provided tolerance and allowed him to not have to take immunosuppressants long term. So siblings really are the best matches for each other. So that can happen where if siblings donate to each other, you might not even need to take immunosuppression medication for the rest of your life, which is a huge blessing. And then make sure you share your story and message with your family, friends, neighbors, coworkers, religious groups, recreational groups. Go on Facebook, Twitter, Instagram, make community flyers, email, church bulletins. I recommend shirts or sometimes bumper stickers on your cars. And I know that seems silly, but I've had people donate kidneys to someone who they saw someone wearing a shirt at Disney World, and to people they've seen a bumper sticker for on a car. So you never just know who is going to be inspired by your story and want to donate to you. And then again, be creative. Those bumper stickers really help. Signs in your yard, shirts, email, Facebook, GoFundMe's, all of those things. Just getting the word out there. And then where should possible donors go? So it's mayoclinic.org/living donor. And I know we just started working with NKR last year with those microsites. So most recipients have those microsites that you can share, and it will get them directly to Mayo Clinic. And we'll also link them with a mentor who kind of helps them through the process. And then do you need to find a donor with your same blood type? No, you don't. These are all the different possible blood groups. And the reason that it doesn't have to be the same blood type is just because we have a lot of different ways people can donate. So many donor recipient pairs are not well matched for many different reasons, like blood type, antibodies, anatomy, or size. Like I'm really tiny, I'm 5'2". I would not be able to give my kidney to a man who's 6'3". It would definitely have to go to someone who's just as small, or vice versa. And then more than 40% of living donor transplants now happen through the process of paired kidney exchange or through advanced donation. And again, there's many options about how you can donate your kidney. So it can be direct, it can be paired exchange, a donation that occurs on the same day as your recipient's transplant. If I wanted to donate my kidney to my brother, but we weren't matches, I would donate to a stranger. That stranger would have someone who wants to donate that to them. That would be a match for my brother, and it would kind of just be a paired like that. Sometimes it's as small as 4 people, or sometimes the chains can be 8 people long. And then there's also advanced donation, where a donor donates for their intended recipient who's going to need a transplant soon, and that person gets a voucher. And so that voucher is good for the remainder of that donor's life, and it gets you put on the living donor list to get a living donor kidney from a stranger. And then again, more information on paired kidney exchange. So it's a process used for donor recipient pairs who are not a good match to one another. An approved donor is able to donate to someone that they match well with, and their intended recipient receives a living donor from someone who's compatible with them. And then again, the voucher. So it's about blood type, cross match, and time. And the first ever voucher donor was in 2014. And now we have a lot of people who do advanced donation. It also helps with caregiving issues. Like if we have husbands and wives who want to donate to each other, but they don't have anyone else to be each other's caregivers, the person who wants to donate will go first. And then the person who needs a kidney will get a voucher and they will get their kidney transplant later. So that kind of helps if you don't have a lot of options for caregivers. And then there's two types of vouchers. There's a standard voucher, the family voucher. A standard voucher is where the donor only names a single recipient who's going to need a transplant within a year. Or you can choose to do the family voucher where you name up to 5 family members, none of who are expected to need a kidney within the year. I've had a grandma who advance donated to her granddaughter because her granddaughter needed a kidney transplant at 2. She will definitely need another kidney transplant in her life. And grandma knows that she won't be able to donate by the time that comes. And then we make you name those 5 people up front just so that no one can like sell their kidney. So it can't change. Those 5 people are on the voucher for life. You can't change it afterwards. And advantages to advance donation. You don't have to wait for the recipient to be ready for transplant. The donor can time their donation surgery for when it's most convenient for them, and it can be a really good option for caregiver limitations. And then we also do remote donation, and remote kidney donation allows someone to donate a kidney to a friend or family member in a distant city without requiring the donor to travel to that city. So we don't see that as often, but if someone lived in like Minnesota and wanted to donate their kidney to you who lives in Jacksonville, you can do that there. It just has to be within an NKR facility. And then we also have the Kidney for Life initiative with the National Kidney Registry. And it's a process for using DNA technology to find better donor-recipient matches to reduce the risk of antibody formation after transplant, lower the probability of rejection, lower the probability of graft failure, and then hopefully lower your immunosuppression dosage over time. And then in summary, we hope that you can take away the following information. That living kidney donation is a safe option to consider. It can reduce your wait time for a transplant and it lasts longer than a kidney from a deceased donor. And your donor doesn't have to be a relative or the same blood type. And then some goals that I want you to think about. Go home and ask a friend or family member to be your champion and share your story. Think of 2 ways you might want to share your story and have information handy for where people can go to sign up to be a donor, like the NKR microsite. And then thank you guys for coming. Does anyone have any questions?
No?
That was very clear. Thank you.
Oh, good.
You just don't want to lose the voucher.
That was
Yeah.
great.
I think I heard you say that if you're on dialysis, that the percentage of success is a lot less.
Over time. So you want to kind of get a transplant as soon as possible. You do get priority on the list, the deceased donor list. And then, of course, you would, if you get a living donor, you can get schedule surgery as soon as possible. You get priority over people who aren't on dialysis if we have people who want to have surgery around the same time.
Okay.
Hello, this is Paula Dorns. I have a question.
Okay.
It's about the medication. Are the pills real big? And if so, can you crush them or you have to take them whole? I'm just curious.
That I don't know. Lakea, do you know?
Are you talking about the medications post-transplant, Paula?
Either or, because I have problems swallowing pills. That's why I'm asking.
So you need to speak to either the pharmacist when you are picking up your medications, and you need to take them as instructed and prescribed. If they cannot be crushed, do not do it.
Oh, I
There
wouldn't.
are time release and instructions. So anytime you pick up medications, they always give a pamphlet, but if you have questions, I always encourage you to speak with the pharmacist, and they can be really specific and tell you if that medication be crushed, if it can be taken with or without food, all of those things. Always discuss with the pharmacist.
Okay, thank you.
Okay. Anyone else have any questions? Oh,
Signing up with the MK, our website, I think it was.
Mhm.
You do that at the Living Donor website to get on the MKR list, or that was at the very end?
I know that the kidney transplant social workers send you the link, or was it the nurse coordinators who send a link?
the nurse coordinators do.
Yeah, they send you a link on how to register for the microsite.
So once you are approved for transplant, and everyone in this group is approved because you wouldn't be getting this message to attend the group. So you can you can portal message or call your nurse coordinator and ask them for a code, because there's going to be a code and information they'll provide you so you can get a microsite.
I have another question. I noticed
Yes.
about the blood type when she was speaking. She was saying that it doesn't matter about the blood, but I was told, like, I think I have like what, the zero negative blood, the one I can give to everybody, but I can't receive. They were saying that I have to get wouldn't I have to get the same type of blood, or does it matter?
You would, but if you had a living donor who didn't have that blood type, they can do paired exchange or give you a voucher.
Oh, okay then.
But that way you don't like rule out people who want to give you a kidney. It gives you that advantage.
Okay, thank you.
Yeah.
Anyone else?
Yes, I have a living donor and I'm already, I'm ready, but she has a few more tests to do because it had been over the year mark since she had been tested.
Mm-hmm.
And her last test that she should be having will be June the 6th. And that will be for an echocardiogram. Once she passes all of these things, how soon after that would the transplant be, scheduled?
It depends on the surgery schedule. So usually within like a month or two, surgery would be scheduled as long as you both are cleared for surgery.
Mm.
Or it could be longer. Like if that wasn't a good time, you can always like delay it.
All right.
And then of course, if there's a cancellation, you can always like put your list on that cancellation list if you guys live close to Mayo Clinic, and you can swoop in there and grab an earlier date.
Mm-hmm. Well, I know my annual will be coming up in August as well. So if it doesn't happen before then I have to do my
Do it all
annual
again.
Wow.
Hopefully not. Hopefully they can coordinate and do it before then.
Yeah.
Okay.
And they do take that into consideration too, and they're doing her testing.
Okay.
Hi, this is Amy. I had a question. Actually two, referring to the previous question on the year timeline for testing or retesting. Does insurance dictate that as far as like right now, Medicare's paying, I guess, for the majority of the testing that's going on with the living donor and the patient, and so at the year mark, if the surgery still has not happened, are there any issues with insurance paying for that additional testing?
No, there's never an issue with that. And then if anything, if insurance won't cover it, Mayo Clinic will eat the cost because we have to get that testing done.
Okay. And one last question. So, I have a sister who is now willing to be tested as a living donor as opposed to another donor that's already been approved this week, but is only a match for 3 out of 5 of the antibodies. And the testing team has told her that she's in line to be tested. When one person's rejected, then they call the next person. How do I go about getting her to the front of the list to get tested? Who should I call on my team?
Call your nurse coordinator.
Nurse coordinator.
Mhm. Yeah, insurance dictates that about only one person being worked up at a time.
Okay, thank you.
Hi, Elizabeth Hartwell here. So as far as if we have someone in another state that wants to get checked to donate, would they call my Mayo Clinic or the one closest to them, or do they just go to the website?
I would have them go to your NKR microsite or come to our Living Donor website and apply for Mayo Clinic Jacksonville, and they'll connect them to the local center closest to them
Okay,
and
thank
coordinate
you.
all that testing. Yeah.
Will this information be placed in the portal?
What information? You're
Uh,
asking for the slides?
Yes, ma'am.
No, these slides will not be placed in the portal. This is her personal presentation. Are you needing the website or some additional information on Living Donor? Because the social work team always gives out handouts and we can send you those. But it is best for your recipient
Uh-huh.
to apply online.
Okay.
There's and then we always there's a 2-page handout we give. So that way, if you have any potential people who are interested in donation, there's a lot of information on those handouts about what to expect, recovery time. It answers a lot of those questions. It's like bullet points. I can absolutely send you that if you send me your name. I can send you that in the portal if you put your name in the chat box for me.
Okay, thank you.
And just a reminder, at the beginning of the presentation, I know Jen mentioned that we keep everything separate. So sometimes we get calls or messages like, what's the status of my donation or my donor's workup? We never get that information. I do not know, your social workers, which is myself, Pat Dennis, and Jeanette, we work with recipients. So we don't have access to what is going on with the living donor side of the transplant. So we always tell patients to get the actual donor to reach out to the living donor team, because that we keep it all separate to make sure there's no coercion or anything of that nature. Right. Any additional questions? And those of you who are asking me for the information, please make sure you're sending me with the patient's full name. That's the only way I can find you in the portal.
I do have another question. Is it a specific age the donor have to be? Does the age matter?
They just have to be over 18. We don't have an age limit on how,
Okay.
like a cutoff age limit.
Thank you.
Thank you guys for coming.
Hey, I have a question.
Yeah.
All right, so my eldest will be 18 in 2 weeks. We know due to the blood type, she is not a perfect match. But do you think that would be a good candidate to do the pair program?
Yeah, if she wants to and she's in a good place in her life to take time off from like school or work.
Well, yeah, because she
Yeah.
graduates like 3 weeks.
Yeah.
Okay.
Yeah, it's definitely always worth, applying and seeing. And then if anything, she'll get a full medical workup and just to see how healthy she really is.
Okay, thank you.
Yeah.
So Jen, I have a question. So let's say someone donates a kidney. If later in life they need a transplant, is there any benefit or anything for them for previously donating?
So they get 3 years credit of being on the wait list for a deceased donor kidney. And then we also work with NKR where they can get put on the living donor list to get a living donor kidney as well.
Okay.
And then, of course, someone could still choose to donate to them if they wanted to.
Okay. Right. Anything else for Jen before we let her go? I do ask that whoever's willing to please stay on because I wanted to talk to you about our schedule for education for the rest of the year. So anything else for Jen?
No.
Okay.
Thank you.
Well, Jennifer, we
very
really appreciate it. And thank
Thank
you
you,
again for
Jennifer.
agreeing to meet with us.
Yeah. Thank you guys for having me. Have a good day, you guys.
You too. Thank you.
Thank you.
Bye.
All right. So I just wanted to bring it to the group to see if there were any topics or anything you all are interested on presentations on for the remainder of the year. As always, we will eventually have our dietary staff and pharmacy present. But is there anything else that you all are interested in that we can possibly have sessions on for you all?
I can't think of nothing right this second.
No?
Think of anything.
Yeah, I can't think of anything either.
Thank you for that suggestion, Elizabeth. I got it in the chat. Okay. So we're working on some things. Last year, for those of you who were with us, we had a panel that we held for recipients, prior recipients, and their caregivers to come join us. So we are looking forward to presenting that again, and that should give insight on what their experience was post-transplant. And again, like I said, we are going to have the pharmacist come and dietitian to come and speak with you all about transplant. We've already held something on self-care, and I don't know if many of you missed it, but at the beginning of the year, we did have a presentation on getting the call. So we are just looking forward to making sure you all are getting the most out of the education sessions. And if you do have any suggestions or there is any topics that you would like us to review, please send a portal message or give us a call. We are always open to suggestions. We want to make sure these sessions are as beneficial as possible to you. Right. Anyone with any questions, anything that we can help with at this time before I let you all go?
No, we thank you.
Thank you.
Thank
All
you.
right. Well, thank you for taking your time out today to join us. It's really appreciated. You enjoy the rest of your day and have a great week.
You too.
too.
All righty.